Hi everyone, it's Dr. Charmain Johnson from Premier Smile Center, and today I'm going to talk about why it's so important actually to fix a cavity. A lot of the time we don't even realize we have a cavity because we don't have any pain, especially when it's just started, and sometimes we don't have pain very often, so we forget about it and we don't realize that this cavity is getting larger. So essentially, if this was your tooth, it's covered by a hard enamel layer. Inside that tooth, past that hard enamel layer, is a softer inside layer of the tooth called the dentin. And then inside that is what the nerve chamber is, or where the nerve chamber is. So when you eat, the food and plaque sits on the teeth and it sits on the enamel. And the bacteria then feed on that and it creates an acid. That acid then eats away into the enamel. It penetrates through the enamel. Now you're not going to feel any pain at that point because there's no nerves within the enamel. But it penetrates through the enamel and gets into the dentin. The dentin is a little closer to the nerve tissue, and that's when you start to feel some sensitivity to cold or sweet. And maybe even just drinking something, but occasionally. Now when you don't take heed of those symptoms, then it grows because it's eaten away at the dentin or the inside layer of the tooth. As it gets closer and closer into the nerve, what ends up happening is you start to feel a more consistent pain. Then you start to feel pain to hot, to cold, to chewing on it. And when it enters the nerve, that's when you start to feel excruciating pain, and it starts to infect the nerve, causing an abscess, and then that grows outside, penetrates through the bone, through the gum tissue, and then you come in to see the dentist with a big swelling or just excruciating pain. So how do you treat this? The way you treat it is, obviously the best way to get to it is when it's in the enamel, and you can just clean that area out and fill it. Now if it's entered into the dentin and it's not too close to the nerve, you can do the same thing. You can clean the cavity out and fill it. But once it gets into the nerve, obviously it's infected the nerve, and you're going to have to clean out that dead infected nerve, and that's what we call a root canal, which is what nobody likes to do. After you've cleaned out the nerve, then you've got to put a cap or a crown on the tooth because obviously it's weak and it doesn't have its nerve supply or blood supply anymore. So take heed of those symptoms that you get when you are feeling some sensitivity to hot and cold. Come and see the dentist, come and see us, let us take a look at it, let's take an x-ray, let's see at what stage it is, and let's help you actually prevent it from becoming something that's more painful and not only more expensive, but much larger, and sometimes you can even lose a tooth. So listen to those little cues that you get out there when you feel something sensitive, and let's take a look at it and help you with that. So just remember, because you're not feeling it and you're only feeling it sometimes, doesn't mean that there isn't something going on there. Give us a call at 954-566-7479 and we'll help you if you have a problem like that.